There will be a presentation presented by Khatuna Chapichadze from Tbilisi.
Yes.
And the presentation, the title of the presentation is as follows: The Anti-Vaccine Sentiments in Georgia. So to some degree, it is a continuation of the last presentation.
Okay, that's great. Thank you very much, Dr. Przemek Furgacz, and the audience. I have a big pleasure to continuously take part in this very interesting and important event as always, and I think the topic of this conference is also very topical, despite the fact that the Ukrainian war perhaps made it much more, somehow a little bit overshadowed, I would say, but the impacts of COVID-19 are still, of course, very important to consider and analyze, and I see the presentation is on. Next slide, please. Well, I just underline the aim very briefly of this paper, and I will try to be as precise as possible and as short as possible, but the aim of this paper is just simply to kind of analyze arguments, or literally major arguments, in fact, of so-called anti-vaxxers who are living in Georgia as well as in the rest of the world. But of course, in this presentation and in the paper, I'm just taking the case of Georgia, which can actually serve to a certain degree, at least, to generalize this problem of anti-vaxxers, if I may call it a problem, but for actually making it much more justifiable, what I've just said about the problem is simply the fact that if we compare different data, diverse data, and statistics, we know that credibility of the statistics is something very, I think, controversial issue. Depends on many, many factors. Of course, how the surveys are conducted, which criteria, what are the indicators, demographics, first of all, of the surveyed, of those interviewed, etc. But here in this regard, I should say that whenever you compare, you try to compare, you always find out, and this is the logical thing, that undeniably, of course, we can speak of the problem here. Why? Because, I mean, with the management or mismanagement, to be much more correct, of the pandemic, not only from the governments, not only from the, for instance, WHO, yes, World Health Organization, or other those responsible institutions functioning internationally or locally, even maybe in some cases regionally, the responsibility can be somehow also addressed to those people who also kind of restrained from vaccination. However, I understand that this is a debatable issue, but this is something which you can come across with whenever you just analyze the situation, not only figures. Okay, next slide, please. And the next one, yes. Mm-hmm. Statistics, in terms of the statistics, what is the Georgia's case? Well, when the pandemic started in Georgia in the early January 2020, I'm sorry, from that time until this is the date of, as of 10th of October of this year, of 2022, we have practically the registered cases, officially registered cases, over 1.5 million of those people infected, yes, by COVID-19. However, and at the same time, very sad fact is, of course, the death roll, and in these regards, approximately up to 17,000 deaths were registered in this period of time. What about vaccines? And vaccines, we know the story with the vaccines, how all, or at least a quite significant number of people, including me as well, were waiting for some kind of a rational solution, which could be, of course, very much legitimized in a way. Why? Because we are relying on the health professionals, doctors, medical doctors. We definitely, as scientists also, perhaps, and responsible citizens, we just look to this kind of solutions, yes. However, we know about the mismanagement, and Ms. Popescu also, Ms. Alba Popescu also, and others. I think during these 2 days I've heard sometimes the sentiments quite righteously that it was the huge problem, and one of the factors of the skepticism actually among anti-vaxxers, or from the side of anti-vaxxers as well, can be somehow justifiable. In this case, well, vaccine doses over what we see, 2.5 million doses were administered in Georgia. However, if we regard that at least 2 doses should be, of course, and were served to one person, to those persons who got this vaccination, approximately up to 39% of the whole Georgian population was practically vaccinated. This is the official figures, and of course this figure is very much lower from the initial plan. From the initial plan of the government in 1 year, as far as the vaccination started, if I'm not mistaken, it was July of 2021. And for instance, me personally, I started to be vaccinated in August as soon as the first wave of ordinary people, apart from the medical professionals and the whole staff, yes, those in risk, got vaccinated. It was in August already, so maybe a little earlier than July, but still 2021, yes. When we somehow analyze how it took place and what was, yes, I was speaking about the initial plan of the government. They said, I remember it very well, that in a year, they intended to get up to 60% of the whole population to vaccinate. Of course, this was a big exaggeration. And I think people could still, even by those times when it was promised, could understand that it was a kind of exaggerated anticipation, let's say. Next slide, please. Yes. The hesitancy, vaccine hesitancy, of course, when we address this topic quite often, we simply are dealing with, first of all, lack of information. We can just analyze in these regards. Lack of information or knowledge or misinformation, yes. Non-sufficient knowledge, but disinformation, which plays a huge role, as well as also misbeliefs, a lot of misbeliefs, stereotypes, some prejudices, which can actually be in line with topicality. Here, next slide, please. And what is the general context of the problem I would like to speak about very concretely is the problem of the skepticism. And this is not only actually connected with the pandemic, definitely. This is my belief, at least. Pandemic still revealed the skepticism to a certain degree. But the skepticism is something very characteristic, yes, and worldwide characteristic to people. But what is this skepticism about? It's addressed to the politicians, to political elites, decision makers, of course, institutions as well, medical professionals too, as we see, but they also represent, of course, the institutions, yes, the medical institutions, we can say. So this is the problem of social capital, which is so crucial. In many ways, it is very crucial if we, especially as thinking and speaking about democracy, about sustainability and viability of democracy, yes? In these regards, we have a huge problem. Why? Because people do not trust. And whenever they do not trust, of course, there can be different cascades of problems which can arise, and even the lenses of conflicts, yes, which we are facing even and witnessing even nowadays. And Ukrainian war is ongoing war. This is a very important war, as we know, after the World War II in this European part of the world. However, it's not the only war, yes? For instance, in the South Caucasus, even we witness escalation, unprecedented escalation. It was in Nagorno-Karabakh, right? Last year, and the continuation this year too. And not to speak about other, of course, conflicts and practically, well, clash of civilizations. I would, of course, mention here perhaps as well, but yes, this is another topic also if we look deeper into what's happening. And it was mentioned already, not only by me, but it was mentioned even earlier at this conference about this practical clash of civilizations in a way. But this lack of trust, yeah, one thing is that we can understand and explain this partly maybe by the fact that it was an unknown virus, yes? Nobody knew it, it was something new, and maybe it can be somehow explained by this kind, even mismanagement. However, well, I totally agree with also, Ms. Albo, to you that it wasn't the first time of pandemic, right? Even the Spanish flu a century ago, it was a huge challenge, yes, by those times for the world. And practically it is the third hugest pandemic. Yes, COVID-19 is the third hugest in the human history after the Black Death, bubonic death, right? And then it was Spanish flu, and the third one is COVID-19. But apart from it, and even just earlier, even in our contemporary times, we witness even maybe globally much more contained, but still epidemics. Yes, and this is not something really new, I mean, essentially and substantially. I'm also, please, next one, and I will look. And yeah, okay, this one. I have another also direction to think whenever I'm actually dealing with this kind of lack of trust, skepticism, the problems with the social capital in these regards. But it's also we can observe, there can be different figures brought here, but I think quite interesting framework for analysis also can be somehow anarchic sentiments, which can be traced, or maybe I think for the future analysis will be quite interesting framework among the youngsters, especially, I would say. These kind of sentiments which are, I think, quite observable, unless, of course, happens in this case of pandemic or Ukrainian war. Also during the crisis, yes, I also agree that the importance of the states and borders became to the very, very closer to the point, yeah, to the core of this agenda, I would say. But still, I think that's interesting framework. The next one, please. Okay, and I will try to conclude, but there are different researches which I'm using even for this presentation, and I will be using in the paper with much more detailed analysis. But what I found interesting whenever Georgian people, those anti-vaxxers, or who identify themselves as anti-vaxxers, one of the researches, or basically two, conducted by the National Democratic Institute, NDI, or CRRC, which is Caucasus Resource Centers, who majorly are dealing with the public opinion polls, investigating that. The dynamics, and it was interesting that those anti-vaxxers in Georgia, at least, they named two major issues, two major problems, which they actually had. The first one was the quality of vaccine, and the second one was the belief somehow that they could deal without vaccination and could practically overcome the problem with the pandemic, yes, COVID-19. And the next slide, please, and I'm closer to conclusion in a way. Yes, online vaccine disinformation is something which is also very important, I think, and I can't ignore this because, yes, the importance of social media especially, and how it's been quite often something is posted and then hundreds or thousands of people then repost it and share, etc. So even if there is some maybe much more credible response to certain, let's say, claims, still it's sometimes quite often uncontrollable, we can say, yes. Even it's a fake news, Vahtank also was talking about in different respect though, but still, or some disinformation, but it's very easy, yes, to spread, especially through the means of internet and social media. media. But especially one research group, very interesting for me, who is majorly studying media and the impact of media in general on societal developments and in regards of monitoring and combating especially disinformation. This group is called Media Development Foundation. And Tamar Kintzurashvili, who I have a chance to, from time to time, also personally interact with, and we are sometimes even dealing with analysis of the data together, etc. But what was interesting to find, and this analytical framework also leads us to kind of somehow to speak about several groups of anti-vaxxers, specifically speaking of Georgia, of Georgian context. And this is connected with geopolitics and security issues also are linked with. The very first group is just general anti-vaxxers, people who are skeptical not only about COVID-19 vaccine, but however, of course, including this vaccine, but in general can be skeptical. They sometimes copy the content and materials from, I don't know, from different resources, from American websites and web pages. But the second group is very interesting and important exactly in geopolitical context. That's groups which can be called Russian. The groups who are influenced by Russia, let's say the agents, not always formal agents, but in many regards, yes, Russia-oriented groups, if I generalize. And these people, in general, are very hostile towards American and European values in general, and everything which is connected with the United States, either Europe or the Western and Westernization process, I would say. So they are hostile and they identify themselves as also anti-vaxxers. I think their narrative is quite clear that they simply tend to, first of all, they picture COVID-19 as a, of course, part of, or majorly within the framework of the conspiracy theory, different theories, and of course they are skeptical about vaccines either. So this is not maybe something surprising. However, this context, geopolitical context, or within the geopolitical context, is also something about the Russian vaccines, for instance, the superiority of Sputnik, for instance, which they tried to promote, or have been trying to promote. Or some priests from very influential Orthodox Church of Georgia, Orthodox Christian Church of Georgia, which officially would not claim, something against vaccines. However, quite important and very authoritative priests sometimes, or bishops even, they sometimes during the interviews would be revealing very hostile attitude towards vaccines. And yeah, well, for many, I think, for the parishes, it could be somehow a call not to restrain from vaccination. But there are, this story goes even too far. Please, next slide. Yes, for instance, with certain, as I mentioned, members of the Orthodox Christian Church, sometimes even very weird comments about vaccine or COVID-19, also calling it like conspiracy of the Satan and Satan's mark. If you get vaccinated, you can be somehow, exposed to the threat, and this threat is connected with your existence and this satanistic narrative. I think this is not something very unusual, but still it's important. Why? Because this is very important institution in Georgia. And very influential. And I think Eka Beraya, yes, from Georgia, also one of my colleagues was speaking about this importance of the church. The next slide also shows one of the experts. I would not really read that, but I will practically just conclude. Yes, the very next, last slide, please. This is not even a conclusion, but just a thesis. I would say that despite the fact that, it's very hard to actually measure the exact impact or credible impact. I mean, the credibility of those studies which try to somehow gauge the influence, yes, influence of disinformation and these kind of campaigns, it's very hard to gauge. Despite this fact, still, I mean, it's very obvious that this is influential, and we have to be careful. And especially the responses, then why we do care why do we care about this? To wisely, perhaps, approach those who are skeptical, and in this regard, concretely, I'm speaking about anti-vaxxers, to somehow prevent or at least mitigate the some hard consequences of the vaccine. Thank you very much. That's all from me. Thanks, Przemek.
Thank you very much.